Hi, good afternoon, or good morning from sunny Miami. This is Dr. John Bennett, the Neurosurgical Channel, neurosurgical.tv. Today we have an impromptu interview with a participant in the neurosurgical conference in Romania. And first we'll introduce the panelists, and then we'll turn it over to the main interviewee. Hello, Adriana.
Hello, nice to see you. I'm glad to have you here with us.
Okay, where are you
Well,
from?
thank
Where are you from, Adriana, etc.?
Well, I'm from Monterrey, Mexico. I now have two blogs where I talk about medical events, and in another one I talk about innovation in medicine.
Very good. Welcome, Adriana. And Simon?
Hello, nice to meet you. I'm glad to be here. I'm a medical student in Tokyo, a neurosurgery enthusiast, and also a developmental psychologist. Nice to meet you.
Very good. Okay, Doctor, could you please introduce yourself and tell us what you're doing at the conference, please?
Sure, let me introduce myself first. My name is İhsan Solaroğlu from Istanbul, Turkey. I'm full professor in neurosurgery, and I'm invited to give talks about gliomas. This is a masterclass course. This is the fourth course in Cluj, Romania. It's exciting meeting because there are more than 160 students, medical students, attending to this meeting, and they will have 2 days lectures about gliomas, glioma surgery, and there are a couple of invited speakers from all around the world. And we are enjoying a lot with students discussing the surgery and anatomy and physiology. So it's a nice meeting.
Okay, so it's more than just a conference on pathology. It's also a conference on neuropathology and neuroanatomy.
Actually, the sessions include basic information about pathology, and there were a workshop, hands-on workshop on radiology and neurosurgical techniques.
Oh, okay.
It is a nice meeting, and with workshops and student presentations also. It's really good.
What did you give your presentation on? Have you given a presentation, or are you running a workshop?
Yeah, tomorrow I will give two presentations. One is new insights into pathogenesis of gliomas. It will be related with experimental work that we are running currently at Koç University in Istanbul. And my second talk will be principles of neurosurgical approaches in gliomas. So I will give two talks, and after that there will be another session that I will be chairman of student presentations.
Okay. We may be televising that. We don't know if we have the technology to do that yet, but we certainly have the technology to do interviews like we're doing now with you. And it's exciting to speak to you because we ourselves at Neurosurgical TV are going to have an online conference next month on brain tumors.
Great.
And we invite you to be part of that, to give online presentations of the work you're doing with gliomas, because of course that is certainly part of brain tumors. And we just spoke to a professor from the Netherlands, Professor Driven, I believe his name is.
Yeah.
And he said he's doing research in the Netherlands, and we certainly want him to be part of that too. So, any questions, Adriana or Simon?
Well, not right now. Not right now.
Okay.
Maybe later.
Okay, Simon, anything to add?
Yes, I have just a question regarding what is an example of a typical a recent advance in glioma neurosurgery in the last 5 years or something.
Okay, we actually during the last 10 years we have very improvement in patient care regarding anesthesiology, intensive care unit, especially imaging. Neuroimaging is well developed. Right now we have many new technologies in imaging. We can do functional MRI, DTI, and we can map the brain, the regions in the brain before the surgery and during the surgery. And also there is especially for intensive care unit, and the technology right now we have during the operations like endoscopy, neuronavigation, ultrasound are well-developed techniques that we can use, and we can extend our resection rates with more safely. Okay.
Just one question: has there ever been a 3D model made of gliomas to show the patient before surgery?
Yeah, actually, it was
I think we had a talk on that. Did Mark Van Ton give that talk
Yes.
about?
Yes.
Yeah. Are you familiar with that, Doc? There's a neurosurgical resident that's doing 3D printing of tumors before the surgery. Have you heard of that technology?
Oh yes, actually yes. For training also, currently for training, it could be very useful. And also what we have in the operating theater right now, previously when the staff neurosurgeon or a professor doing the operation, the residents are one of them or two of them were observing under the microscope. But what we have currently, we have 3D microscopes, 3D cameras attached to our microscope. Our residents can watch these operations in 3D on screen. So it is very important for resident education, resident training. And also, by having advanced softwares on neuroimaging, before the operation, we can reconstruct all the data in 3D, and we can see the tumor very well. We can see the adjacent tissues, vascular tissues around the tumor, and also we can show whether the tumor is invading or just how can I say, just compressing the brain or not. So by this way, as I told you before, we can do more safe operations, and the health by doing like that, the quality of service, health services increased very well.
Yeah. So there's less surprises when you actually do the surgery, correct?
Tell me again, please.
There's less surprises. You are more
That's right.
fully prepared before you.
That's right. That's right. Yeah, this is like this is like a flight. An operation is a airplane flight. So you have to prepare yourself before the operation, and what we call that half of the operation is done before the second incision.
Yeah, simulation.
Yeah, that's right. That's right.
The simulation.
That's right.
Yeah,
Doctor.
Well, you know.
Doctor.
Go ahead, Adriana.
Oh yes, doctor. Is there any therapy that you recommend before going to the surgery to reduce the size of the glioma? I mean, I know there are many different, but which is the one that you prefer to use in your own practice?
Actually, before the operation, there is no specific treatment for gliomas. The current treatment modalities include surgery first, and then if it is like grade 3 or grade 4 gliomas, additionally you can give chemotherapy and radiotherapy to the patient. But generally for grade 1 and grade 2 tumors don't need chemotherapy or radiotherapy. Surgery is enough in many cases. But there is no specific treatment currently available, but a lot of researchers are working on that, including our team, to understand the molecular biology of glioma, how to and trying to develop new drugs, more efficient drugs for gliomas, because in the last 15 or 20 years, the overall survival time increased only 3 months. That's all.
Hmm.
Okay.
Well, Doctor, we're not going to keep you too long. But let me just tell you, I know you're working with new technologies to improve treatments, and let me tell you quickly on the technology that Simon, me, and Adriana are working on, which is this communication platform of Google Hangouts. I spoke to a doctor in Ohio whose son was diagnosed with a multiform glioblastoma after having been kicked in the head in a soccer injury, and they just picked up the tumor. He's 18 years old by accident, and I talked to him, and he told me about it. And I said, "Wait, let me connect you with a oncologist in Brazil that's doing a study on multiform glioblastomas." So within 10 minutes, I was able to connect that patient in Ohio to someone that's doing research on new drugs and glioblastoma. So we're doing our part with technology too, and we're glad to be able to bring you to the screen. And we hope to have more hangouts, more formal hangouts with you. And we're going to have an online conference on brain tumors probably next month with the doctors
Hmm.
from Brazil, the U.S., from the Netherlands, and we hope that you can be part of that.
Yeah, hopefully. I want to.
Okay, I'm going to send you the address to this interview, and we hope to see you soon.
Thank
Okay,
you very
thank
much.
you.
Thank
Thank you
you
very
very
much.
much.
Thank you.